Hello and welcome to another episode of Healing America and Beyond. I am Mary Grace, the host and founder of The Mary Grace Show and the Mary Grace Media Network. And I have with me here our esteemed Dr. Sean Baker, author of The Carnivore Diet, one of the most renowned and effective, I would say, doctors in the carnivore space, who is bringing people into new heights, new levels with taking control of their health. It's good to see you back, Dr. Baker. How are you doing?
I'm doing well. Like I said, I just got done working out. I will announce that I just got my first dunk, an actual legitimate basketball dunk at age 58, almost 59. So, first one since I was 50, last time I did was 51. So I've been working a little bit for the last 6 months trying to get there. So I hit my
Wow.
first official one today. So onward and upward.
Congrats.
My goal is to do that at 60. So I've got a little over a year until I turn 60. And so anyway, that's good. I feel good about
How
that.
long how long did it how long did it take you when you made the decision from making the decision?
Probably about 6 months. Yeah, 6 months
Okay.
of specific just training, jumping, and
Mhm.
what's really moved it lately is just readopting some Olympic lifts. So I started doing some power cleans again, stuff I hadn't done in about 15 years, and so that
Interesting.
sort of correlates pretty well. So getting, I'm certainly not a world-class technician when it comes to cleans, but that it stimulates what it needs to stimulate by yanking on the bar really hard. And anyway, I'm sure most of your listeners don't have
No, I think I
just
think I wanted to talk to you about fitness today.
okay.
I know you have some housekeeping to do. I know you have some reposting and tagging and things like that. I will do a little bit of housekeeping on this end, and as people are coming in, I'll make some announcements. One of the things I want people to know is that this is not we have a doctor here, but we're not giving medical advice. That's the disclaimer. We are here for educational and informational purposes, and hopefully a little entertainment. But if you do want to get in touch with Dr. Baker and his team, you certainly can do that at Revero.com. And you can do a telemedicine session with them. And we've seen great results with them. But please do keep in mind that today's show is informational, educational. Also, if you're not sure how to find out about these shows that we do, please go to my website, marygracemedia.com, and join the mailing list. You will get an email prior to the show. And that way you can just click on the link of your choice to go and watch the show. The other thing I wanted to let people know is that we are going to be doing a little bit of Q&A today on today's show. We like to save that for the end of the show. And so what we're asking you is that if you don't mind, hold your questions until about the bottom of the hour. And then when you put a question in the chat, please do a QQQ. And that way we know it's a question and not just a comment, because we're scrolling through trying to find your questions and we want to get to as many as we can. And so that's a really important thing. We're trying to make it the most efficient for everybody involved. And we are very happy to have you here today. If you are on whatever channel you're watching on, we ask that you would tag, that you would repost, that you would share. We want to get the word out to as many people as possible, because we are hoping that more and more people, not only across America, but beyond, healing America and beyond, will be able to take charge of their health and see real healing and growth. No, outside of maybe the allopathic, traditional, pharma-driven medical system. That's what we're hoping to see. And so today's conversation, we've got a few things on tap for you. We are going to be talking about strength. I wanted to talk about salt. I don't know if Dr. Baker will be down for that, but then I have a couple of questions of my own. And so let us know in the chat where you're watching from. We do talk a lot about the carnivore diet because Dr. Baker wrote the book, The Carnivore Diet, and he is one of what we would call the gurus in the space. And so let us know, like, if you've been on the carnivore diet, if you're thinking about it. That's one of the things people ask questions about it. And so again, if you have questions, please hold them until the bottom of the hour and do a QQQ before your question. I see a question in there, but please just maybe copy it and paste it for later, because we kind of lose the chat. I think that's it for now. I wanted to see if we have any people watching on my channels. I see a bunch of people on Dr. Baker's YouTube. I see. Oh, yes. Yeah, there we go. You have a ton of people here. We're on X. We're all over the place. I think we're on both Rumble channels today, so we're very excited about that. Dr. Baker, I wanted to kick us off today talking about salt. I was setting up my Amazon store, and I made a whole list of salt because I just like different salts. But
Mhm.
I also know that there are health benefits to salt, and I think this is one of the most, widely misunderstood parts of diet and health. And so I just wanted to ask you your thoughts on sea salt, that type of thing. Is it essential? What happens when people have too much? What happens when they have too little? It seems like a lot of people in the carnivore space tend to need a little bit more of it, especially when they first start. What are your thoughts on that?
Yeah, interesting. If you look at like the sort of the prevailing advice from the medical community about salt, they said, salt is harmful and we should minimize it. There's a lot of associational data that would support that. And I think most of that data basically doesn't take into account where the salt is coming from. That is to say, where the vast majority of Western people get their salt is in conjunction with salty food, which means think about potato chips, think about, canned soups, thinks about all these processed foods. And this is where the most of us get our salt from. And I think that alone is probably the driver of that relationship. Now, the other thing is, it's shown that there is a certain percentage of the population that their blood pressure is dependent upon salt intake. So some people that have high blood pressure will respond favorably to salt restriction. That occurs. And that number is, some people debate, somewhere around maybe 15-20% of the population that has hypertension that is quote unquote salt sensitive. But I think more importantly, where the problems with sodium comes from particularly is not that we're ingesting sodium, it's that we're retaining sodium. When we retain salt, fluid kind of follows it. So when we're full of salt, we're full of water, and we're full of fluid, we tend to be, we just tend to be swollen, right? Our blood pressure goes up because there's too much, fluid in the vessels, more or less. It's not quite that simple, but I mean, that's an easy way to think about it. And so that's where we say, well, if we cut the salt, we're going to improve. But really, what is driving the salt retention is really the question we should be discussing, because what's driving the salt retention is, the kidney. It's the kidney's job is to filter stuff out, and then it reabsorbs a lot of it. So normally it's going to filter out sodium and glucose and a bunch of other things, and it's going to reabsorb some of it. What is causing it to reabsorb sodium? A multitude of factors, but one of those factors is insulin. And when insulin is very high, the kidney just holds on to a lot more salt. So that's why you see a lot of people when they initially go on a low carb diet, we often see their insulin level comes down, and we see this with our Rivero patients. We look at our first 1,000 or so patients, and we consistently see a reduction in insulin. But because of that, the kidney starts to release more sodium, and then you become less hydrated, which if your blood pressure is high, that's a good thing because it kind of brings it down. Now, some people can basically it's too much. And so then they have to, redial that back in by consuming a little bit extra sodium. That's why
Mm,
probably a lot of people that have been on low carb, ketogenic, or even carnivore diets have been told, hey, during the early transition phases, in order to avoid the symptoms of dehydration, which things are like headaches or fatigue or heart palpitations or cramping, up your sodium or your electrolyte intake. And so I think that holds out. I mean, it seems to match for a lot of people. I know there's a lot of people that have opinions on what's the best salt. Is it sea salt? Is it Himalayan salt? Is it some special, brand of salt and stuff like that? And I don't know that the evidence is overwhelmingly clear on that. I know there's people who disagree with that. I mean, some of the salts, like, these different varieties of salts have different flavors and tastes because they have a little bit different mineral content. You can get like smoked salt and Icelandic lava
mhm.
salt and all these black salts and red salts. And I mean, I think that, it might provide a little bit of a difference in mineral content, but I think just generally the biggest thing is the sodium content. I mean, really it is, because we do need sodium. I mean, our blood is essentially isoosmotic with seawater, which is kind of interesting. We are very salty. Our blood is quite salty. If you've ever, I don't know, if you ever cut yourself and licked your blood, you probably find out to be salty. I know most people may not have that experience, but So sodium is obviously an essential mineral. We have to have it or we die. How much do we need? I mean, like for instance, I'm on a carnivore diet. Meat has salt in it. I mean, just like I have salt in me, so does the meat. So I mean, I'm getting sodium and potassium. There are many people within this community that don't add salt, and they do reasonably well. Now, I think one of the distinguishing variables is how active you are. If you're like we talked about, I just got done exercise. I'm kind of sweaty, and there's
Mhm.
salt on my skin.
You
My dog,
dunked. You did the
my
dunk.
yeah, I did my first basketball dunk at age 58, well, not my first in my life, but first time since I've tried in a
Yeah.
long time. But yeah, so I've got a lot of salt on my skin right now, so I've got to replace that. So
Mhm.
I think that's where some of the differences in opinion or experiences is how if you're sweating a lot, then you're probably gonna need a little more salt.
Mhm. Well, I had an interesting experience, and that is that, I was having a lot of cramping, and I found that just eating a little bit of sea salt would help, especially in my calves and feet. But the other thing that I was experiencing was having a very hard time with fats. And I would get, without being too graphic, what some people call disaster pants, where it's like all of a sudden, like you have to go. And I think that means that things aren't really digesting well. And my functional medicine doctor recommended that I take just, add sea salt more than I was using. And so I was measuring out a teaspoon a day, and then I would take in a little bit throughout the day. That really seemed to help a lot. Why is that? Why does that help with fat, I guess, absorption and processing and having it, stopping it from going right through you?
Well, I mean, as part of one of the jobs of the intestine, particularly the large intestine, is to reabsorb electrolytes and fluid. And so when that is sort of not dialed in, then you have problems with it, with I think absorption in general. And I think,
Mhm,
I think so. So you want to make that, uh, you want to make that environment as optimal as possible. And not to mention the fact that a lot of our neuromuscular control, we have all these voltage gated ion channels,
mhm,
and electrolytes are going to impact that as well. So the muscular function of the gut, remember, the gut is a big, long, smooth muscle, and it functions, and it's responsive to the nervous system, largely the vagal nerve, the vagus nerve, which provides some of the input. But when the electrolytes are out of whack, it can cause issues with that. So I can see where that might have an impact there.
mhm. Now, do you think that it is important for people to grab on to these, electrolyte mixes and packets, and there's a lot on the market right now because I think electrolytes have become de rigueur in the health space. Uh, what do you think? Is it enough simply to get some sea salt, or maybe grab, supplement with some magnesium? Or do you think that these electrolyte mixes, have a place in hydration and electrolyte balance?
Well, I mean, I think they have a place in that it's convenient. It's
Mhm,
kind of dosed maybe appropriately. You can argue how appropriate it is. It's a lot of it tastes. Certainly some of them taste better. If you just drink plain old salt water, it doesn't taste very good. I've done that in the past, and it was not my favorite thing to do. So, I mean, there is a convenience
yeah,
factor. Obviously, is it necessary? Probably not. For most
mhm,
people, just supplementing with a decent salt is probably more than adequate for the vast majority of people. It's just, one again, it's a convenience taste type of thing. And yes, I mean, some of these have, outside of this, the sodium chloride, which is table salt, they have things like magnesium, potassium. Sometimes some of them have calcium, which arguably have some benefits. So I think it wouldn't be my first thing I would try. I mean, I think I would try, some people will use like bone broth, or they'll just have a
mhm,
little extra salt in their food. And that works for a high percentage of the people. So I wouldn't go immediately to one of these more expensive electrolyte drinks. And, I say that while I'm literally sipping one right now, but,
you
uh,
just
you know,
okay,
but I just don't say, I don't think that the majority of people necessarily need to. I mean,
mhm,
certainly
mhm,
if you've got extra money laying around and you like the way it tastes and so on and so forth, it's beneficial. Now, there's some people that, like I said, I know there's been a lot of blowback because some of these things have flavoring in there, and some people that are really particularly sensitive to additional
right,
ingredients are gonna say that's not for me. So again, certainly not essential, maybe convenient, maybe I think that's probably the biggest benefit.
Yeah, everybody's in a different place, obviously. And one of the things that I think is really important as we talk about the carnivore diet, a meat-based diet, whatever you wanna call it, it is really, I think, important for people to understand their baseline. I mean, there's some people who just have a lot more issues going into it than others. I mean, I know that, I have an autoimmune condition and, some people just have different genetics, like my dad, he's 88, he's kind of old school. And like, I think he has a stomach of iron. And I just didn't get that, And so I think everybody, there's just people just respond and react differently to different things. And I think as you look at even making a change, especially if it's a drastic change, isn't it better to do a little bit of research, have a little bit of a baseline understanding of what issues you're dealing with before you jump in fully? What do you think about that? I don't know if I phrased that very well, but
Well, I mean, yeah, I mean, it's nice to know what you're dealing with, what you're treating, what your
Mhm,
diagnosis is. It's always like people often, it's kind of funny. I see patients every single day basically, and I've talked to thousands of people over the years, and a lot of them get sort of hung up in the minutia. And I say, well, what are you trying to achieve here? And I
mhm,
mean, at the very basic level. And when you talk to most people, it's like, hey, I want to feel good. I just want to feel
mhm,
good. I
mhm.
want to feel good. I want to
Yeah,
function well.
yeah.
That's really it. I mean, we're not talking about I want my ketone level to be this, or I really want my LDL to be this level. I mean, that's not the real basic thing that we're trying to achieve. So we have to break that down to where you want to go. And, I mean, there's depending where you're starting, there's different routes you need to take and different things, different obstacles you have to move out of your
Mhm,
way. And
mhm.
so we have to, kind of figure that out. But I think,
Yeah,
obviously
yeah.
being able to objectively assess where you are is really important because, like people say, things that don't get measured don't get changed, or, it's hard to
Mm,
do that. So,
okay,
um,
okay.
so yeah, I'm often sort of walking people back and trying to have them think in big picture terms. That's how I tend to think.
Mhm.
A lot of the people that get just so into the minutial stuff, I kind of think we probably don't know anyway, and it probably doesn't matter that
Mhm,
much in a lot of
mhm.
cases.
Okay, great. I think this is a good time since we're talking about getting a baseline and understanding, measuring and getting a starting point. It is time for our little commercial break. So, take it away. I want you to share about what you are doing at Rivero, and then also you have a special announcement coming up about Rivero. Tell our listeners what you guys are doing over there, how you're helping people, and then we'll have a word from another one of our sponsors today.
Yeah, thank you, Mary, for that. So Rivero is a digital health company. We're licensed in all 50 states. We take care of people with a host of different diseases, whether they're metabolic diseases, inflammatory diseases, autoimmune disease, and we have a team of doctors. We have an entire provider team, clinician team, health coach team. We get daily feedback. We monitor you on a daily basis, and then we make changes in real time. So we're constantly helping you and assisting you with this struggle because sometimes it's not as simple as, hey, just go eat this diet. I mean, sometimes you need to have that support there. So we provide that. Now, the announcement we're going to make is, 3 years ago when we launched, well, when we didn't launch, we raised funding so that we could start to build out the company. And now we've successfully done so. We've again got licensed in all 50 states. We made it through all the regulatory and legal hurdles to do that. We've got providers, throughout the country, and we've got, essentially our first 1,000 patients through. So now we're going to expand and we're going to raise more capital to allow us to do that. Now, what we're doing is we're doing a crowd raise like we did last time, and we had about $3 million raised from the crowd fund. And a lot of people were upset because they didn't know about it and they couldn't get in. And they wanted to invest because, you
Okay.
own a part of our company. And as we become successful, then you obviously hopefully get somewhat of a financial return on that. So we're going to be doing that again very shortly, I think on Monday, this coming Monday. I don't know when this episode's coming out. So that would be, I think, the 22nd or so of September. I believe that's Monday.
Yeah, today's the
And
19th, and
yeah,
we
today's
are
19th.
live, so we're out
Yeah.
now.
Okay. Yeah. Okay. So,
You
so,
can
so yeah, on Monday, keep an eye out. I think we'll make an announcement. You can invest as little as $150 up to, a lot more if you wanted to. So we're looking forward to that. Again, that will allow us to continue to expand what we're doing. Our results so far are really awesome. I've seen the data on the first like I said, 1,000 patients, and we want to expand it and help more people. And I think it's a great
Excellent.
opportunity if you're looking for something to invest in, and that maybe it's aligned with what you feel is important.
And we have the website up here. It's Revero.com. You can always scan it to get there as well. And I wanted to highlight also one of our wonderful sponsors. I know that a lot of you have taken advantage of this. We work with a company called GridDownChowDown.com. And the idea is that when the goes down, you can still chow down on your favorite American grass fed, grass finished beef. And we have some right here. This is freeze dried beef, and it is ranched and processed right in the heartland of America. These guys are based in Oklahoma. They work with local ranchers and farmers. And so, if you are interested in getting this either for stockpiling or everyday eating, you can get this freeze dried beef. It's not jerky. It's ground beef. You can rehydrate it, and then you can make any recipe that you would make normally with ground beef. They have a subscription model, which a lot of people like. You do save a little bit when you do that. Make sure you use the promo code Mary Grace when you go there. GridDownChowDown.com, promo code Mary Grace. One of their most popular items right now is pre-made burger patties. And so you really don't have any excuse for not having time to do carnivore if you're getting pre-made patties and this is pure, right from the heartland, American, grass-fed, grass-finished. And that being said, if that's not in your budget, you can definitely get something from the grocery store that is not necessarily grass-fed, grass-finished. That's better than not doing a meat-based diet at all. But if you want to support these farmers and ranchers, please go and do that. And it does help sponsor our show. GridDownChowDown.com, promo code Mary Grace. And as always, if you are liking what you're seeing, please subscribe, follow, repost, share, tag people. Send this to somebody who you think might be able to use this information. It could actually save somebody's life. And if you want to get further notifications, please go to marygracemedia.com and sign up for notifications. One last thing I'll tell you is that a lot of people do feel the need to add supplements to their diet for one reason or another. And we want you to get the purest, most trusted supplements that you can find. And that's why I've set up a store so that you can actually get those supplements. And we have a store that everything is curated. We work directly with the manufacturers. That's Mary Grace Essentials. And you can go to Mary Grace Wellness, Get Healthy .store. The link is also on my website. It's easy to go there. It's free shipping, 10% off every order for new customers. And then we also have a subscribe and save option. And that way, that what you're getting is actually what's on the label. And we can't always guarantee that from some of the other big box stores. Dr. Baker, back to what we're discussing today. We are here with another episode of the Healing America and Beyond. And I have a question about me. I'm going to do the first question. So I'm 60. And my family, we have a history of heart disease in my family. My grandfather, my mom's father had a heart attack. My mother had a heart attack, quadruple bypass surgery. Now, neither one of them was as active as I am. And they were smokers. I'm not. However, I do have an appointment with a cardiologist, just maybe to get a baseline, right? And to see where I am as a 60-year-old woman who has an autoimmune condition and maybe some predisposition to these things. What do I want? What should I ask them? What kind of test do I want? What am I looking for when I go for the first time to a cardiologist?
Well, I mean, they're going to want to assess cardiac function. So, I mean,
Mhm.
they're going to obviously do a thorough H&P. They'll probably get some basic labs. They'll do the typical cholesterol, blood lipid panel. They might want to know what your thyroid status is. They might want to know what is going on with your chemistry, glucose, and so on and so forth. And then, having an autoimmune disease. I mean, this is one of the reasons, depending on a lot of these, particularly inflammatory autoimmune diseases.
Hashimoto's.
Yeah, so that's
Mhm.
an inflammation of the thyroid, and so a lot of times, if it's associated with systemic inflammation, the inflammation itself is a big driver of some of the cardiovascular disease, and so you
Okay.
see people with like rheumatoid arthritis, their risk for cardiovascular disease goes up several fold. And so it's a pretty big deal,
Mhm.
quite honestly. So that's probably the thing. Now, as far as, you know, I mean, they're going to ask you, are you symptomatic? Which, I mean, do you have chest pain when you exercise or anything like that, or fatigue or any signs of congestive heart failure, which I'm sure you don't. And then, beyond that, if there's any indication, and this is the thing, because when people are paying for this, insurance companies paying for, it's like, well, is it indicated? Do we need to do this stuff?
Mhm. Right.
And so, I mean, if you were to saying, hey, sometimes when I exercise, I get a little bit of soreness or tightness in my chest, and they would probably do a stress test. They might be doing,
Okay.
or, if you couldn't tolerate that, they do a nuclear stress test or an imaging test. There's chemicals they can give you to make your heart rate speed up without having you do exercise. Beyond that, but the imaging is really, I think, the thing that we want to know about, because that really
Mhm.
kind of shows us what's going on with the heart. It's not just speculative. It's not just risk factor. It's like, what is going on with my heart right now today
Mhm.
on, September 19th of 2025.
Right, right. And what imaging? I've heard there's what is it, the
Yeah, so
CAC?
there's something called a coronary artery calcium scan. That is basically a CAT scan of your heart. It's a very simple test. It's very quick. It's about a 10-minute procedure. Um, the nice thing about it, it does not require an IV. It does not require any invasive stuff. There's no
Okay.
like dye or something like that they put in your vessels, which has potential downsides. And it's a good screening tool, right? It's like if it's zero, if you're 60, as if, and it comes back zero, that puts you in the, at 60, that's going to put you in the lower percentiles of risk. You're going to be in the,
Okay.
bottom quarter, or maybe even bottom 10%, perhaps. I don't know the exact numbers off the top of my head, but
Mhm.
so that means you're pretty unlikely to be at high risk for cardiovascular disease. That's probably a nice, easy screening tool. And many cardiologists will actually do that now. And I think maybe it's justified because, like for instance, if your cholesterol is high, they'll consider that a cardiac risk factor. So then you can say, can I de-risk this person? How might I de-risk that person? And this might be one of the tests where you do it. Because if you have no other concerning symptoms, I mean, you talk about family history, and again, smoking kind of throws a monkey
Mhm.
wrench in there. And so it's kind of like one of those things. Well, maybe you have, maybe they'll say, well, she's got this autoimmune disease. She's got a family history. Her cholesterol might be high. It, they might be able to justify ordering the test. And so you can get the
Mhm.
test done. And if it comes back zero, you're like, okay, good. That's good news. Maybe I can proceed as
Yeah.
I'm doing. Beyond that, let's say you have a more complicated picture, or, you want some more, what I would call precision on that, because this is a general screening tool. It shows
Mhm.
calcium that's been laid down.
Sure.
This usually ends up meaning it's old plaque. It's plaque that's been around for a
Right,
while.
right. Okay.
Calcified. Some people have all this soft plaque, which you don't see on a calcium scan.
Mm.
That would be something that would require, typically, depending on where, in the coronary arteries, we're typically going to do something like an angiogram, which requires injecting dye into your vessels and then imaging it that way. You can potentially do, like the neck, you can look at with ultrasound and kind of get an idea if there's a plaque in carotid vessels, soft or hard plaque. And, you know, again, but it's a little bit different area, and it has maybe a little bit different prognostic factors, I suppose. Um, there are also, more expensive tests out there. There's a couple companies that offer an AI guided angiogram analysis, CT angiogram analysis, which, gets into the, now you're talking $2,000 to run one of
Mhm.
those. And then there's also these kind of, they look at arterial stiffness. They call these like pulse wave tests, where
Mm.
they'll basically send a signal down the vessel, and they'll see how fast it propagates, and they can kind of tell how stiff the arteries are. We want arteries that are very flexible. That's generally a sign of healthy artery. When they get real stiff and
Mhm.
hard, it's like
Right.
an old hose. If you ever had an old hose, it's real stiff and it just
Mhm.
kind of breaks. It's something.
Interesting. Yeah.
So there,
Wow.
so I mean, but I mean, I
Yeah.
think at the beginning, I mean, I think probably I say, hey, can I get a calcium scan? That would be,
Mhm.
now if the doctor won't order you one, the good news is you can order it yourself in most states. I can't remember, because I think you're Virginia, if I'm not mistaken.
Virginia. Mhm.
I don't know.
Yeah.
I don't know for Virginia, but the vast majority, I think something like at least 46 or 47 of the states, you can just order it yourself and go online and look up
Mm.
calcium scan, and maybe
Okay.
whatever bigger, whatever city you're near, in Richmond or whatever the big
Yeah.
cities are that might have something like that. So.
Right. Yeah. My nurse practitioner thought, well, let's just, with your family history, let's
Mhm.
just try this. So that's the route I'm gonna take first, see what my insurance does, right? You never know. They don't pay for any of my thyroid medication because I use Armor.
Mhm.
So I'm like, "Okay, why do I have insurance?" But, so that's a whole different question, right? Okay, thank you, and hopefully that's helpful to other people in the chat as well who are listening today. Are you ready for more questions? Is there anything else you wanted to cover before we move into the Q&A?
Well, I just mentioned, this is all this because this always seems to be a common thing. Two recent papers came out this year, and unfortunately, I don't have them in front of me. I can't give you the exact title, but I will tell you the synopsis. One was a meta-analysis of randomized controlled trials, so considered like the highest level of evidence on whether reduction in saturated fats decreases your risk for cardiovascular disease. And they looked at, I think it was, I don't know, there's 13,000 people, and these are randomized controlled trials. This isn't just the typical epidemiologic survey, which is kind of meaningless.
Mhm.
So these were higher quality evidence, and basically they came to the conclusion that looking at all the randomized controlled trials we could find on whether reducing saturated fat has an impact on cardiovascular disease, the outcome was no, it doesn't seem to make a difference. So I mean that's interesting. And then another randomized controlled trial meta-analysis came out looking at the impact of low carb diets versus high carb diets
Mhm.
and its impact on traditional cardiovascular risk factors. And once again, found out that in general, low carb diets tend to lower most of the cardiovascular risk factors. So, I mean, that's just again, this is when you start looking at the higher quality evidence. When we look at the low quality stuff, the food frequency questionnaire, we ask somebody what they ate once every 10 years and try to get a good study out of that. It's,
Right.
it may point the other direction, but I think we're seeing more and more evidence that, we can we can relax a little bit around saturated fat and those types of things and lower carb diets. And we're seeing, and I think they've not fully been released yet, but I think the dietary guidelines are going to lift a lot of the concerns around saturated fat, particularly when they come from
That's good.
whole unprocessed foods, because the majority of Americans, like the salt I talked about at the beginning, the majority of Americans get their saturated fat not from meat and eggs and fish and dairy products. The majority of it comes from processed foods, desserts, things, sandwiches, things like that. That's where most of the saturated fats
Mhm.
come from. So once
Mm.
again, it's tied up in all this
Yeah.
kind of ultra processed junk food. And so when we look at whole unprocessed food, steak, ground beef,
Mhm.
chicken, fish, eggs, things like that, hey, we don't see a big signal.
Yeah, it seems like we keep coming back to the same thing, which is, uh, ditch the ultra-processed foods. That seems to be the key, to making a lot of, important and consequential changes in your diet. It's, even if you're not quite ready to go, to what you might consider an extreme, that is a really good first step, is look at what you're eating and, look at the level of ultra processed foods you're eating. If it's comes from a drive-through, it's ultra processed. If it comes from a box, it's ultra processed for the most part, right? And if it has a label that has more than like 2 ingredients, it's processed. So that's just something to consider. I think, as we talk about this, it just keeps coming up. And so it's not the saturated fat that's the problem. It's not the sodium that's the problem. It's the fact that it's all wrapped up in some kind of ultra processed food-like substance that is actually not nourishing the body. And so we we are wanting to encourage people to make that change. Are we there you said there were 2 things you wanted to cover. That was the first one. There was something else.
No, I think that I discussed those 2 studies, basically. I
Okay.
think
Oh,
that
the 2 studies.
that were the
Okay.
2 studies I wanted to
Okay.
share, so.
Okay, good. So we'll jump into a couple of questions. It looks like we have people who waited until the bottom of the hour, which makes it so much easier for us to find the questions. Do you see this question of MC, 50-year-old woman? Um, I can read it for you. It's
Sorry, my chat was closed. I don't see.
oh,
Oh,
okay.
now I start to see it. Now I see. Yeah, there's a bunch of them. No,
Okay,
okay.
I can read it. So this is I'm a 50-year-old woman. I've been carnivore for almost 2 months. I'd like to get off my bioidentical hormones. How do you recommend going about that? So that that maybe.
Well, I mean, I guess, and again, I don't know anything about this particular person. I'd say, why,
Yeah.
why do you want to get off the bioidentical hormones? I mean, I know it's controversial. I mean, I will tell you that the medical consensus right now is for women, postmenopausal, menopausal, that, the net effect of bioidentical hormones is probably more beneficial than less beneficial. And that's our new, what is Marty Macri? He's now the head of the,
Oh, yeah, yeah, he was talking about that this week.
is he the FDA chair? Yeah, he's the FDA chair. That's one of his big things. And again, I'm not an expert on that particular thing, particularly when it comes to women's hormones. However, like I said, what was the reason you went on the hormones in the first place? I would say, what were you treating symptomatically? Did it help you? And then can you even improve upon those symptoms with diet? And if the answer is yes, then the question becomes, are the hormones now superfluous? Do you need them anymore? And then, obviously, probably for most people, tapering is going to be a good solution for that. And, the problem you run into is a lot of physicians aren't very good at deprescribing tapering because they're just used to people being on meds for the rest of their life. That's one of the things we do at Rivero, is we're very good at removing medications from patients. So I would look at it from a symptom management. Like I said, why am I on a drug in the first place? What is it doing for me?
Mm,
And then, if you can achieve the same or better results with lifestyle, then why the hell wouldn't you do that? Right. I mean, it makes better sense. Right. So, I
right.
mean,
Yeah.
now again, a lot of physicians, you'll come to them, they'll, maybe you're on this drug for 3 years and you go on a diet and then finally your symptoms go, and what do the doctors say? Well, if it sounds like the med's finally kicking in after 3 years, right? Whatever, it's because they just can't,
Yeah.
can't wrap their head around the fact that a dietary shift could be as powerful as it is. And it often is. So, I would, like I said, I would say, am I symptomatically better? And then if so, can I taper these medications? Because again, sometimes abrupt medication shifts can lead to a lot of discomfort, I would say.
Excellent. We have a comment, and not a question, but I think this is a good one. This is TX Rafe on X. Lost 90 pounds in 4 months so far because of Dr. Baker and the carnivore community. Very little exercise, eat meat till satisfied, drink water, eggs, bacon, butter, salt when desired. Wow. So we do see some drastic, big weight loss, especially with people who are starting out from obese.
Yeah.
Obviously, somebody like me doesn't need to lose 90 pounds. But that's fantastic.
Yeah, I
Excellent.
mean that is a very, very common thing. I've seen that.
Yeah,
I've seen people lose as much as 500 pounds on carnivore. So,
amazing.
but the caution I would say is, eventually, you kind of get into this plateau period. Now, depending on where you start, if you're starting at 400 pounds and you get down to 310, you still need to lose another 100 pounds. You're still going to have to manage things and adjust things and make those overall lifestyle modifications. And the diet that you start with, I eat a ribeye twice a day, may not still work, 6 months later. So you got to start
Mhm.
playing with that and manipulating things. And I think, a
Mm,
lot of the levers you have to pull are the big five for me are nutrition. I think nutrition is absolutely essential. You got to have decent nutrition. You got to sleep well. And a lot of times they go hand in hand. When you start losing weight, you sleep better. A lot of times you're not snoring as much. You're more comfortable. There's not so much pressure on different points. And then beyond that, it's activity. If you're sedentary, and he mentioned he did no exercise. Well, now that you've lost some weight and you start feeling better, start moving around a little bit, even
mm,
if it's just walking. And then you can kind of like I was in my twice a week, I have meetings with the Rivero patient. I was just talking about how can you redefine who you are? If you've spent 30, 40 years being obese, sick, more or less disabled, how do you change that? Because it's a mindset. It becomes who you are in many ways. And you have to unshackle yourself, unburden yourself from that sort of, just self paradigm. So you got to be able to just kind of change who you are, who you want to be, like you say, what is the limit of preventing me from being something that
mm.
I would rather be? Because no one wants to be someone who's
Yeah,
stuck and sedentary and sick. No one wants that in reality. Maybe
yeah.
it's sometimes take a break and just chill, okay, I'm just going to sit on the couch and relax. Well, but no one wants that for the rest of your life. So you gotta just kind of continue to make those changes. It's always going to be work. I mean, it's never going to be like free. It's never going to just kind of, um, I put a lot of work in for what I'm able to, for what I do. I enjoy it. I have fun with it. I mean, but it's still work. And some days I don't want to do it. I do it anyway most of the time. But yeah, congratulations. By the way, that's wonderful achievement, and good luck. And I hope you continue and get all your goals and inspire other people. That's inspiring. It really is. When,
It really is. Yeah,
you inspire
congratulations.
you inspire the people around you, and then it's always nice to share how you did it. And
Yeah.
yeah, this is awesome.
I think the next, our next session, we have talked about your approach to exercise because it's something that you're really passionate about, and I think that we should. I'd like to focus on that on our next episode because you really get people inspired. You've inspired me to do more, uh, you know, more work physically. I can get in like thousands of steps a day
Mhm.
just around the house, right? But the heavy, lifting heavy things and doing more, strength related, it has to be more intentional, right? And so I think a lot of people may be like that. We have a question from, I think it's a question, Dale on Facebook. Um, he or she says, "I'm basically on carnivore, but my ferritin is very high. Is meat hurting that condition?"
Well, I mean, there is, obviously a condition called hemochromatosis, which is often associated with high iron deposition. And the problem with excess iron is it deposits in various organs, the liver, the pancreas, and can lead to disease of those organs. And so I don't, again, without knowing what's going on and also what is considered high, because, depending upon what lab you're looking at with the reference range, some people will say, over 400 is high, and I can't remember the units off the top of my head on ferritin, but so you have to say, well, what is actually, how high is high? And if we're talking in the several thousands, and that's consistent with things like familial hemochromatosis. In general, what I see is, and we have to think about how iron is handled in the body. Iron, we don't have a good way to get rid of iron. Women more so than men because women menstruate and they lose a little blood every month, but guys tend to accumulate iron a little more. And so the way the body typically handles iron is by limiting what we absorb, right? When we eat a lot of iron, let's say we eat a bunch of steak or leafy vegetables or something like that, leafy green vegetables, and we got all this iron in our gut, not all of it's getting absorbed. And in fact, if you've ever like taken iron supplements and you talk to people about it, what happens when they go to the bathroom, they have these black stools. That's
Mm,
iron in their, basically has iron in their poop because it didn't get absorbed. So
yeah.
what's keeping the iron from getting fully absorbed? Well, it's under the sort of the direction of a hormone called hepcidin. Now, hepcidin is made in the liver, and when hepcidin is appropriate, we absorb as much need. But when hepcidin is inappropriate, either too much or too little, we don't absorb the right amount. And interestingly, and this always keeps coming back to this. Ben Bickman would love me for all this stuff I'm talking about. Hepcidin is affected again by insulin. So when insulin is too high, then hepcidin is inappropriate, and then we tend to accumulate iron. So as we get metabolically healthier, even if we have a familial condition, like I've seen people with this, genetic hemochromatosis where they have super high iron and they got to donate their blood once a week or twice a week or something like that, go carnivore, and their iron levels come down significantly to the point where
Mm.
they don't have to donate blood or very infrequently have to do that. So I think, we have to think about the long-term picture. Acutely, if you're metabolically unwell and you're just eating lots and lots of iron, you may start accumulating a little bit. But if the long-term effect is that you become more and more metabolically healthy, then it starts to reverse the other way. That's what I've seen over time.
Thank you. We have a question that came in a little earlier. I think this is probably a common question for people. This is Metalhead Hippie on YouTube.
Okay.
Um, so I love the names people think of. Can a problematic gallbladder cause high ALT and AST numbers to climb way out of range? Because mine are in the high hundreds. They were normal. Pure carnivore for almost 2 years, non-drinker.
Can gallbladder disease lead to problems with liver function enzymes? Yeah. So the short answer is yes, it can. There's, and again, the gallbladder basically stores bile. Bile is created in the liver, and then it's secreted into the small intestine to help emulsify fat. That's the purpose of bile. There's got a few other purposes, but that's what we generally think about it. Now, if bile becomes backed up for some reason, sometimes you get a common duct stone or something like that. If there's something that's causing sluggish bile excretion, that can cause kind of backwards backing up of the system. It can lead to the liver having basically inflammation, which is often represented by high ALT, AST. Now, depending on how high those numbers are, now typically they run like the top of the reference range is like 42 or 48 or something, depending on which one you're looking at. If they're like slightly above, that's less concerning, in many cases, in my view, because not that it's not necessarily, it could be a problem, but often it's just like any kind of stress can drive up liver enzymes temporarily, like a hard workout. Literally, if you go out and just kill it in the gym and you check your liver enzymes the next day, they might be bumped significantly. And that usually lasts for even up to a week. We've got studies that show it lasts for a week. So short answer is yes, gallbladder issues, bile issues can secondarily be associated with these other enzymes that are being elevated. And B, I mean, it may or may not be a problem. It just depends. So I just need more information.
So we have, I think, we have somebody that has an issue that happens to people when they go carnivore. And this is, oh my gosh, on YouTube. Carnivore 6 months. I eat 1 to 2 meals, down 40 days. The last few weeks, I'm struggling to eat more than 3 mouthfuls of meat without wanting to be sick. What is happening? I'm struggling and forcing myself to eat.
Well, I do see that from time to time. It's interesting, more in females than males for some reason. And I mean, if I think about all the reasons, some women get pregnant. Now, I don't know what her history is, but I see that first trimester pregnancy, a lot of women become meat averse. We see that
Okay.
Sometimes, there's a point where, a lot of times many people come to a carnivore diet in a relatively malnourished state, even if they're obese, because obesity doesn't necessarily mean, it means you've got a necessity of energy on your body, but you might be deficient in protein. You might be deficient in some other, micronutrient. So you might still be hungry. Sometimes when you go carnivore, you just eating so much high quality nutrition that you might just go, I don't need anymore. I'm full. And I don't mind if someone doesn't eat for a day or two. I mean, it's not the end of the world. You might just take a break, say, cut it back, dial it back, hold off on that, fast for a day or two, and see if that resets that. Because a lot of times, we just, or the other thing is, sometimes if you have a lot of excess body fat and all of a sudden you've now gone into a fairly decent amount of ketosis and you're now liberating all this energy, your body just doesn't need any. You've got all you need. So some of those things are going on. And again, without knowing the specific details on this, those are some of the things I think of. Generally, it passes, and sometimes you just have to say, if I don't feel like eating meat, don't eat it for a while, and just take a couple of days, a week off, or whatever it might be, and then, and then try to slowly reintroduce it. And sometimes it's the preparation, sometimes like, oh, I just can't eat another bunch of fat, sometimes it's too much fat going on.
Yeah, sometimes it's the cut, or like
Yeah.
if you're just eating all ground beef, then maybe switch it up, that kind of thing. I've noticed that it's easy to get maybe a little averse even to a texture. It may not be just the meat, right? Or maybe just eat some eggs for a while. So I think that you're not alone on that. Here's a good question from David Hendricks on YouTube. Carnivore for 3 months, 12 pounds down, and in ketosis. When will the acetone breath, taste, smell go away? Good.
So, acetone is a ketone body, right? So this is, there's beta hydroxybutyrate, which we see in the blood. There's acetone, which we see in our breath. And then we also have a byproduct we find in the urine. And that usually is indicative of you're wasting a lot of energy, right? It usually means that like how much ketone body is floating around in your breath and your urine and your blood and your sweat is really dependent, is a product of a couple things. It's how much are you making? So how much fat are you liberating off your body, minus how much are you using? So when you get really efficient at utilizing ketones, when your brain's using it well, when your muscles are using it well, when your heart is using it well, guess what? It's being used up. It's not sitting around in your blood as much. So right now it probably indicates that you're relatively early on, you're not utilizing it very well. I think that a lot of times people find that, particularly those that exercise a lot. I mean, we see that people that work out a lot on a ketogenic diet tend not to have a lot of high ketones because they become very efficient. Their muscles become very efficient at utilizing those because they don't have a choice. So the ketones just don't last very long. So those are some of the things. So a lot of times it's just being better adapted to it. Now you can always, like, I rarely produce high ketones. I mean, in order for me to do that, I have to do some pretty extreme things. I have to not eat for 2 days. I have to eat only fat and not eat for a couple of days. And then I might start to see a little bit of ketosis. But I mean, for me, I'm just so efficient at it. And we've seen, some of the studies that have been done on athletes on ketogenic diets showing that they don't typically produce a lot, once they get adapted to it. So it may just be a period of, a matter of being chronically adapted enough.
Okay. Thank you. And I think do you want to do one more question?
Sure.
Okay. So, and then at the end, I think people want you to repeat the information about the investment opportunity for Rivero, but we'll come back to that. Dr. Baker, this person, Derek on X, can you ask Dr. Baker about AFib and carnivore? I've had persistent AFib for a few months, and since then lost over 10% of my body weight, down 31 pounds. I have an ablation set for late October. Have you ever heard of AFib reversing with carnivore? I'm only about 2 months in.
So yes, I have heard people improving their AFib on carnivore. That's I'll put that out there. Why that may be, atrial fibrillation is a electrical problem in the heart. The heart has a little electrical system, right? We've got what we call the SA node or the sinoatrial node, and we've got these what we call this bundle of His and Purkinje fibers, and it drives this electrical signal. So that the SA node fires, tells the heart when to contract, and then it's supposed to fall into an organized pattern. AFib, that gets disrupted. So something is happening in that neurology, in that nerve system. And a lot of times what we see is the same thing we see with like peripheral neuropathy, like people have diabetic peripheral neuropathy. Those nerves get glycated. They don't work as well. We see that reverse not infrequently, particularly diabetics that get, better control over a long period of time. I think it is a slower process. So I think, if we can, control blood sugars, make sure we're stabilized, maybe tend more towards fat as fuel, we might see some improvements in that. The other thing that sometimes I used to see a lot with particularly my older patients was atrial fibrillation would occur with big fluid shifts. And as we talked about at the beginning of this program, we're talking about salt. Sometimes hydration status, if you're extremely overhydrated and your heart is stretched a little more, sometimes that can disturb the electrical signal, as can the electrolytes, by the way, or if it's, there's not enough in there. So I think sometimes it's a matter of having the right appropriate hydration status, and then maybe the nerves can heal. I mean, maybe, they can sort of recover from this perhaps damage that's being, caused by perhaps glycation. Again, that's speculative. I can't say there's definite studies that show that, but it's just what I think is going on. But the short answer is, I have seen several people with AFib improve that, and so the ablations, they work sometimes. Sometimes they'll put you on, rate control medications, put you on beta blockers and a few other meds for that. But again, and then of course, with atrial fibrillation, one of the big concerns with that is formation of clots. And when you get clots in the heart, where they worry about the clots are going to break loose and go up in your brain and give you a stroke. So they'll treat you with some sort of anticoagulant. So we want to, whether it's warfarin is kind of the old one. There's new meds that they use for that now. So, but short answer is it potentially could. It's worth trying. Try it for 3 months, see what happens.
Somebody in the chat said that they have seen testimonials of people on YouTube, I'm assuming in other carnivore chats and things like that, who have reversed AFib.
Yeah, I've seen it. Yeah, for sure. I've for sure seen it happening. Yeah.
So this is where I think definitely the individual experience comes into play and all of the underlying issues that each person has, right? Um, we do have one more, maybe Some Guy USA. I think this is a good one because it really aligns with you. Tim Noakes' recent study showed 4 to 6 weeks to adapt to keto for athletic performance to normalize. What is your experience?
Uh, for me, I think it's longer. I mean, I think it depends on. I think it depends because Tim's really. And I know Tim. Tim and I have talked many, many times over the years, and for those who know, he's a world class sports scientist research. He's an MD, but he was had a big interest in running, and he wrote some of the seminal literature on running, and he changed his opinion about high carb versus low carb later on in his life, and so he has looked at a lot how carbohydrates are probably not necessary for most sports, certainly lasting less than an hour. Once you get beyond an hour, there's some benefit to adding a small amount of carbohydrate. It doesn't have to be this massive like carb loading, which so many people are doing, where they're doing 60, 80 grams an hour or something like that. And so I think that, again, it depends a little bit on the person, what the sport they're engaging in, how intense that sport is, what they've been used to. Because if you've been conditioned to using carbs for your performance for 30 years, and then all of a sudden you said, hey, I'm going to switch over, you're going to struggle for a while. You're going to struggle for, a couple months, maybe even, I've seen some people take 6 months or longer to get adapted to that. When I switched over to a carnivore diet, I was probably kind of breaking even for about 2 months. But by about 6 months, I was clearly better than I was before. I mean, there was no doubt about it. So, there's some period, lengthy period. And the problem is most of the studies, because they cost a lot of money, tend to be short period of time, usually 3-day studies or sometimes 2-week studies. And, the criticism to that is that, hey, you're not even adapted yet. You're still having, hydration issues. And so, I mean, I think we're finding out that the longer adapted athletes are, the better they can perform the long term, if that's what their desire is. I'm absolutely convinced you can perform at a very, very, very high level, in a low carb state. I have no doubt about that. Or at least some of us can. I can.
Okay. I think this is a good stopping point for the questions. We've had the YouTube chat has been incredibly lively today, so
Okay.
you might want to go check that out later on your YouTube channel. We're gonna put the link back up here for Revero.com. Dr. Baker, can you reiterate what's going on with the investment with Rivero, this round of fundraising, so that people can know what to look for?
Yeah. So again, Rivero, we are going to, in order to, expand the scope of what we're doing to scale, we've already, like I said, we've already got licensed in 50 states. We're off and running. We've got our patients. We've got about our first 1,000 patients done. So we're not expanding. So we need to raise funding so we can, bring this more to a larger scale, to, enter the corporate world, so we can start to offer our services to, big companies, Ford Motor Company, or UPS or whatever, things like that. And in order to do that, we're going to be raising, quite a bit of money. And generally we would go to venture capital and they would give us some money, and then they would make money when we make money, right? We would prefer to open it up to the crowd, because I think these are people that benefit. And I think this is something that is a unique opportunity that, you can invest in a company at the earlier stage. We're not at the very beginning, because we've already launched and we've already proven that we're viable and working, but it's just a way to, A, support what we're doing, but B, hopefully, make a reasonably high yield on your, return on your investment, provided we obviously, grow and become successful. It's like, if you had the opportunity to go back and invest in Apple 30 years ago, all of us would say, yeah, heck yeah. But you don't know. I mean, there's no telling we're going to be Apple or not. But I mean, I certainly think we're going to continue to because what we're doing is the right thing. And I think particularly in today's climate, to make America healthy again, I think the political and the just the cultural climate right now, that it's right for this type of stuff, what we're doing. So this will be found on something called Republic. Republic is a crowdfund venture capital, basically, vehicle. And so I'll be making those announcements on social media. I believe on Monday, unless we have to delay for it. We have to do it. We had to do a long audit with the SEC and all this stuff, so that we're
Mhm.
allowed to do this
Mhm.
stuff. So all our financials were went over to make sure we qualify, and
Yeah.
all that stuff's been done. So anyway, exciting times.
Somebody just asked if you're integrated with the VA system. I'll tell you, that would be fantastic,
Well,
right?
it's I know, I do think I worked in the VA system,
Yeah.
as a physician a little bit, not much, but it is such an inefficient,
Yeah.
frustratingly, like, not a as much as I love the veteran. I'm a military guy myself, but it's just crappy efficiency over there. It's
Yeah.
slow, it's
Yeah.
antiquated. I mean, the computer systems are like 50 years old. I mean, it's just like VA is tough, but I mean, they could use some help for sure, no doubt
They
about it.
sure could, and this may be the time to do that, right? That if there is any time that that might be possible, this could be it, right?
Yep, for sure.
So if anybody's listening and you have an in with the VA, and you wanna contact Dr. Baker, reach out to me, reach out to Dr. Baker. We can see if that would happen, if that's something that Rivero might be able to help our veterans. I would love to see that. So I wanted to, I think that we're gonna wind up here. And everybody who's here today, please, as if you like the content that you're seeing today, please subscribe, like, follow, share the show today. Please, if you haven't gotten on the mailing list, please go to marygracemedia.com, get on the mailing list so that you can get an email prior to our shows. Also, please remember to support our sponsor for today. We have GridDownChowDown.com. This is American grown, grass fed, grass finished beef right from the heartland. You're supporting American farmers and ranchers and helping to save that farmland when you buy this. Please mention Mary Grace and you can subscribe. You can get a monthly order, things like that. It's a fantastic way to get your ground beef supply. We also want to encourage people, if you're buying supplements like magnesium, anything like that, please go to a trusted source. You can go right to my Mary Grace Essentials store. You can access that from my website, or you can go to maryggracewellness.gethealthy.store, and we work directly with the manufacturers. The sources are guaranteed for purity and quality, and you don't have to worry about getting counterfeit products when you order from us. We do a subscribe and save. We have free shipping, and new customers get 10% off. So please check that out. maryggracewellness.gethealthy.store. Dr. Baker, is there anything else you want to finish with today? Oh, wait, I wanted to say I did put together a list of what I would call carnivore essentials on my Amazon store. And that is things like sea salt, broth, electrolytes, fats, tallow. A lot of people want to find good sources of tallow. And so this is just one link where you can go to a list. If there's anything you'd like to see on the list, shoot me an email, info@marygracemedia.com. We do get a little percentage every time you buy from that list. So everything helps, but jump on over there, take a look. And that might remove some of the guesswork. Now, the meat isn't on the list. Like here's the meat right here. But
That's the biggest essential.
right, people are looking for tallow and things like that,
Yeah.
and the salt, and so that's what's on the list. The broth, right? If you're not making your own bone broth and things like that. So I'm trying to make it easy. It's right over there, Carnivore Essentials, and it's over at my store, which is on Amazon. It's simply Mary Grace, and you can just check it out. And so I think that's it. I mean, we've had a wonderful audience today. Lots of people chatting and watching on all of our channels. So we really appreciate that. I think we'll be back in 2 weeks at this same time, right here on all of these channels. And so we always want to encourage everybody to go outside, touch some grass, look at the sky, put your phone down, disconnect from the electronics, and take some time to breathe and move your body. And if it's your first day doing that, great. It's the first step. So anything else, Dr. Baker, that you want to finish with?
No, just just realize that you have a lot more power than you think you do when it comes to your health. Don't feel disempowered. If you've got a chronic condition, disease, there's a lot of things you can do, and you're not necessarily tied to or dependent upon some doctor to write you pills all the time. So just
Excellent.
empower yourself and let's take things in your own hand and win.
Wonderful. This has been our 8th episode of Healing America and Beyond. Mary Grace and Dr. Sean Baker.